All righty. Well, good afternoon, everybody. Welcome to the third session of the Virtual Elder Law Fair. My name is Samantha Agwam. I'm a Deputy Director with the Volunteer Lawyers Project, and I'm here today to help facilitate today's presentation on caregiving support and resources. We have a few awesome presenters coming up, a very packed hour of information. So you'll get to meet each of them as they speak, but I just wanted to go over a few things before we get started. Just to begin with, you will notice if we do have live captioning for the event. So if you'd like to use that, you can click on the live caption option at the bottom of your screen and take a look at that and click the option for subtitles so that you can see that. Just as you're here, it probably means that you were able to find our website and register for the event. But just to remind you that all sorts of details about this session and the last couple of sessions and our next one coming up can all be found on this website. Registering for them again. We've already uploaded the presentations from the last 2 weeks if you had to miss them or had to step away and couldn't watch the whole thing, and lots of other good resources on the resources page that's also there. So please do check that out for any information you may need about this event. And next week, like I mentioned, after today, we'll have one more session this month to end up the month on estate planning. So hopefully you can join us for that. But again, if you can't, we'll upload it to that website, share it on multiple platforms, and hopefully you can watch it at some other time. And just really quickly, I just wanted a big thank you again to our planning committee for this event. AARP, Deborah O'Shea and Robert O'Connor, Colleen Gibbons with the Center for Court Innovation, Lee Gata with the State Planning Council of Central New York, and Jeff Unitas with Onondaga County Bar Association, Joanne Spoda-Decker with the Onondaga County Office of Aging, Ingrid Gonzalez McCurdy and Odisha Hernandez at Senator Rachel May's office. Jenny Ackley at Vera House, my colleagues Bethany Hemingway and Sally Curran with Volunteer Lawyers Project, as well as attorneys Alan Weinstein and Emma Cardle. Again, super helpful in having this event take place, these series. So with that, since we have limited time and a lot to go through, I'm going to pass it on to our next speaker from AARP, Nancy.
And I'll start. Thank you. Thank you, Samantha. Yes, my name is Nancy Ketz. I've been a volunteer for AARP for the last 16 years, and I'm currently part of their Speakers Bureau. One of their topics, and one that's near to my heart, has to do with caregivers. Family caregivers provide the majority of long-term care in the United States. The goal of AARP's Prepare to Care program is to help support you and your loved ones as you navigate the rigors of caregiving. The portion of my presentation today is going to be 3 parts. First, I'm going to illustrate an example of caregiving. Then I'll get into a PowerPoint with AARP's 5-step plan for caregivers, and I'm going to end with AARP's resources. Some of these I believe you've already received from Samantha, but I will repeat for you what they include. Caring for a family member or friend is probably the most difficult and most challenging, yet the most memorable and most rewarding role you might ever play in your life. It often starts as something very simple, possibly giving somebody a ride, but then it will most likely progress into something that's more physical or more emotional or more demanding. Every caregiving situation is different. The important thing to know is that you're not alone. No matter where you are in the caregiving journey, it helps to be able to anticipate the needs and be prepared. That's why AARP has come up with its Prepare to Care guide to help guide you. I'm going to start by illustrating a typical caregiving journey, and I invite you to count on your fingers the different instances where you might have something in common with my journey. My journey started as a 5-year story, actually, very simply when Mom was 95 years old. She lived independently in her own house, which she wanted to do, 3 hours away from me, and she was in excellent physical and mental health for a 95-year-old. I visited every single weekend because I wanted to provide her with company. I wanted her to be able to socialize. And that wasn't a problem. If you socialize with somebody that you're caring for, if you provide them with companionship, give yourself 1 finger. I'm going to give myself 1 potato because visiting Mom was small potatoes. Not a problem. Gradually, I took on a few more responsibilities. I saw Mom carrying a laundry basket up and down a flight of stairs. And even though she didn't want my help, she got my help because I was not going to allow her to do that. I took over the laundry duties mainly for safety factor. And I'll give myself a sweet potato for that because that was a sweet thing for me to do. As you can see, juggling two potatoes is not difficult, although I'm not talented enough to really juggle. If you helped with laundry duties, give yourself two fingers. I had been doing the lawn mowing and I decided not to do that anymore. I hired a neighbor to take care of the lawn mowing and the snow removal, but I took responsibility for the payments for that. So I'm there 2 days a week. I'm doing the laundry, I'm managing the lawn care, and I'm providing companionship. So we're up to 3 potatoes right now. Everything went well until age 98. Mom drove her car into 4 parked cars in a parking lot. She voluntarily gave up driving, but I helped take care of the insurance. I helped take care of the body shop. I helped take care of selling the car. And so I'm going to give myself a lemon for the car. These were things that I juggled one time, but keep in mind, Mom wasn't driving anymore. So I was responsible now for the appointments, driving to the primary doctor, the eye doctor, the hearing specialist, the podiatrist, the hairdresser, and the grocery store. This meant scheduling Mom's appointments into Fridays or Mondays, and then scheduling my life to be there for 3 days every week. So that's about 4 or 5 more potatoes. How many fingers are you up to now? Maybe you're up to taking off your shoes and counting toes a little bit. Well, right around this time, Mom fell and broke her arm. When she got out of rehab, she wasn't able to do the housework for a while. So we add in a potato for the housework. And then, of course, meal preparation. It's hard to cut anything when you have one hand you can use and one hand that you can't. So I took over the duties of food preparation, including freezer packages for the days that I wasn't with her, because she was able to nuke them herself. So by this time, I'm juggling like crazy between the grocery shopping, the yard work, the yard management, the laundry, the companionship, driving to appointments, scheduling the appointments, scheduling my life, and the housework. How many potatoes am I juggling? What's going to happen? They're going to start to crash because I just can't juggle anymore. By age 100, we added in bathing, dressing, bill paying, banking, changing bandages, managing medication, having conversations with the doctor, cleaning up after the little unexpected accidents that happen, and providing emotional support. The list goes on. This is why AARP realized that one person can't do everything and one person can't juggle it all. That's why they wanted to come up with a plan to make the task doable, because it is doable if you have a plan. So what I'm going to do now is switch my screen to the PowerPoint program to go through AARP's, where is it? AARP's 5 steps. Slideshow. View show. There, I think we've got it. AARP's Prepare to Care 5-step plan. The first step, starting the conversation, progresses to forming a team, making a plan, finding support, and taking care of yourself. The very first step, start a conversation. Very often, families avoid having discussions about the future. They don't want to think about the changes in the life of their loved one. A lot of times people don't plan for it until the crisis actually starts. People don't often want to talk about their values or their preferences, their wishes for health care, or details about their finances. It's never easy to start an uncomfortable topic. However, it's easier if you talk about it before there's a crisis. A few things to keep in mind when you're starting that conversation is look for an opening. Now, a lot of times, if you're not sure when to exactly start a conversation, you might refer to an article you read in the AARP magazine or something that you saw on TV. You might start with something like, I just read an article about gathering your financial papers together. Would you like me to help you with that? Is there some time that you could show me where yours are? Try to find the right opening for the right topic. The topic I kept trying is maybe we should give up driving. And that one lasted for probably 5 years longer than it should have. But always look for the right opening. Respect the wishes of your loved one. Make sure that this is not a monologue or a lecture, that they have an important part in deciding what's going to happen. It's important for them to be the center of the caregiving plan. Where do they want to live? How do they want their finances taken care of? What do they want? They're the focus of the whole conversation. Size up the situation. Once the conversation starts, evaluate what you're hearing. Understand their priorities. Then try to determine the next steps. In Mom's case, it was easy. She was willing to talk about a lot of different things, but her priority, she had to live in her house. She would not move in with me. She wouldn't move in with my brother. She didn't want assisted living. Once I understood that she wanted to stay in her own house, I was able to negotiate the other issues. Review the finances. Money can be an important part of the decisions that you're going to make. They could be at the heart of the issue. You might want to consider how things are going to be paid for. The housing, the health care, the groceries, the medication. Ask your loved one what their bank situation is, if they have investments or insurances that can take care of these issues. Like I said, I was lucky. Mom was willing to talk about this. But a lot of time, the loved one might say something like, I don't want to talk about it. Maybe they're private by nature and don't want to discuss their finances, or maybe they're hesitant and resistant because they don't want you to know they're having financial difficulty. But it's important for you to understand what the financial situation is. If they're resistant to a conversation, stop, switch the subject, go to anything else, and come back to the topic another time when they might be more receptive to it. Or you might try to get intervention from somebody else that they might trust, a trusted family friend, another relative, their doctor, maybe somebody from their church. Try to find some way to broach the subject, but it's going to be important as you make your plan. Once you have an idea, you start to form your team. And team members to look for could be from your family or friends or neighbors. You will find there's a time when this job is too big for just you. And you also want to remember to avoid burnout and problems with your own health and well-being. Sometimes you do need a larger network of family and friends. You need to share the load. So if you find somebody who lives nearby, proximity has advantages. Someone who can just pop in and say hello and just see that everything is good. Or maybe somebody who could give a ride once in a while to one of the appointments. Somebody who can bring a meal over. That's always a good idea too. If you have family members who live far away, that doesn't mean they can't help. They might be able to help with things via computer. I know in my case, my brother in Texas was responsible for taxes. That took a huge load off my mind because I didn't know how to handle that. Also, don't hesitate to consider simple tasks. Don't hesitate to ask somebody to do something that's very small. In our case, there was a little 10-year-old girl across the street, and she was always asking if she could help. The morning after garbage night, when Mom's trash bin was out by the road, this little girl would go and pick it up and bring it back to the garage. It's a small task, but mom appreciated it. I wasn't there on Wednesdays, and the little girl was so proud of herself that she did something helpful. There's no such thing as a task too small. Sharing talents. Leverage the talents and strengths of the different people on your team. For example, if somebody on your team is a computer whiz, they can take care of setting up a calendar, setting up schedules, setting up the appointments, coordinating the meals, and they don't even have to be in the same town to do that. They have a special skill. In my case, my brother in Albany was very handy with tools. If anything needed to be repaired or added to the house, we would just put that on his to-do list. I remember one day when he installed grab bars in the bathroom and near the kitchen door, and that was helpful because of safety. You never know, but to always find out what a person's talent is, and then to communicate with your team and communicate with your loved one. Make sure that the person receiving the care is satisfied with the people on the team and what their tasks are. Your loved one might actually identify somebody that you never thought of, or they might come up with a task that needs to be done that you hadn't thought of. You need to build your team and you need to support your team. Determine how many people are on this team. It's always good to have a lot of people, but that can become cumbersome also. It can get confusing when people aren't sure who's doing what. It makes it more important to have good communication. Make sure that everybody knows exactly what their responsibility is. Make sure that they're supportive and willing. Focus on the recipient of the care, because remember what they think is the most important thing. As you're making your plan, it often helps to have a meeting. The plan doesn't have to be huge, doesn't have to be fancy, and you can't always anticipate everything that's going to happen. The plan should be broken down into two parts. What are the immediate needs, and what are the future needs? Keep in mind that a lot of this will depend on the finances that are available and the willingness of your team and the resources available in your community. Then hold a meeting. In my case, the meeting was done via computer. I couldn't get everybody on the team in the same place at the same time, but that was okay. We kept communication open via computer, and you can also do it with a teleconference if you want to. As your team gets together, one of the things I found most helpful was AARP's Prepare to Care guide. Now, your resource package at the end will send you to a website where you can find this 30-page guide. It is downloadable, and if you don't have the access to a printer, you can contact AARP and have a hard copy mailed to you. This 30-page guide contains 4 pages that I used so important in this process. It was 4 pages of checklists that break down every possible task that might need to be done. It had everything from home maintenance, which would include paying the rent or the mortgage, safety concerns in the house, lawn care, pet care, housekeeping. It had financial issues. Who's going to pay the bills? Who's going to keep track of the finances? Transportation needs. How do you coordinate the different driving? Personal care. Who's going to help with the grooming and the dressing? Who's going to go clothes shopping? It adds health care. Who's going to talk with the doctor? Who's going to make the appointments with the doctor? Who's going to take care of the medical bills? Explaining the medical decisions to your loved one? Managing the medication, making sure the prescriptions are filled. Another thing on the checklist involves communication. How are you going to communicate with all of your team members? Socializing. How are you going to make sure that your loved one isn't out of the loop? How to make sure that they have contact with other people? I know one of the things I did for socializing, I used to help mom with her Christmas cards every year. And when she started using email at age 96, I put her email address at the bottom of all of her Christmas cards. And she was surprised that so many nieces and nephews started writing to her after many years. She hesitated to use the phone because she did have hearing loss. So she did rely on the emails, and she loved having those communications. Even though she did it with one finger typing, she still was able to communicate with nieces and nephews. Adaptive devices. Who's going to make sure the I have fallen button gets paid for every month? And who's going to communicate with the emergency crew when they respond when that button gets pushed? These are all different things that could come up at your team meeting. You assess your goals, you communicate with your family members, and make sure that if there's any change that takes place, make sure that everybody on your team knows about it so there's no surprises and no hurt feelings. At the end of a meeting, it wouldn't hurt if somebody had been taking notes that can remind everybody of what they've agreed to do. Is this moving down? There we go. The fourth step, I'm not going to spend time on today. It has to do with community resources, and I believe our next two speakers are going to be addressing this in detail. But do be aware that at the AAR website, you can find another list of support. It includes hiring help, safety issues, and options for housing. But the most important thing I got out of all this was step 5, taking care of yourself. Don't overlook what the impact of caregiving can do to you. You have to pay attention to your health and your well-being. The best way to ensure that you can take care of your loved one is to make sure that you're taking care of yourself. Don't forget what happened when I tried to juggle all the potatoes and lemons. Here are some tips. Tap into resources. Social workers, nurses, and other professionals can guide you and help you, especially if you don't live nearby. Use technology. Use the personal emergency response systems like the I have fallen button. Ask your employer. I was lucky I was retired at the time, but many employers offer benefits and services to help family caregivers. Review your own finances. It's important to calculate how much of an impact family caregiving has on your own budget. It's been estimated that the average family caregiver spends close to $7,000 a year in taking care of their loved one. Talk to your own doctor. Make sure that your doctor knows that you're a caregiver and discuss ways that you can manage the stress. You might also contact the loved one's doctor to find out if there are any tasks that need to be done at their home and how to do that. How do you administer medicine? Is it in the morning, or is it with food, or is it before breakfast? What are the different things you should know medically, especially if you're not a medical professional, because I'm certainly not. Take advantage of caregiving services and support. That'll be coming up in the next 2 presentations. Take a break. Remember to exercise every day. Remember to sleep every chance you get. Make sure that you eat healthy food. And also, very important, stay connected to your own friends. You can't shut yourself out socially. It's always important, even if it's just having somebody to vent to or somebody to have a laugh with. Now, those are the ideas AARP came up with. I have one that's my own personal one that I'd like to add to the list. Take a lot of photos of the good moments during your caregiving. It's amazing that these are the times that you will remember the most. And this is what good memories are made of. I remember the day 4 weeks before Mom's 100th birthday. She wanted to go out to lunch. And so I said, fine, we'll go to lunch. We got to the restaurant. She looked at the menu and said, if I eat lunch, there won't be any room for dessert. So she ordered a brownie sundae with 2 spoons and said, we can do lunch anytime, but I really wanted the ice cream and the brownie. This is what memories are made of. Another piece of advice I got was from the hospice nurse. She saw at one point that I was a little bit stressed and I had a mop in one hand and a sponge in the other. And she said, don't obsess about being the perfect housekeeper or the perfect cook. Remember to be a daughter. And that was probably one of the most valuable things she could have said to me. So those are AARP's 5 steps for Prepare to Care. They have a variety of information, resources, and self-paced learning online. In particular, the one on the left is the Caregiving resource, and this is in your packet. It is a hub for everything caregiving, the latest articles, tips, and advice, and it has that downloadable 30-page